A claim that has worried many parents suggests a link between common medical interventions and autism. This idea gained significant public attention partly due to comments made by public figures including President Donald Trump. The claim proposes that either childhood vaccines or the use of Tylenol during pregnancy could be a direct cause of autism spectrum disorder in children. The claim oversimplifies a very complex scientific and medical topic. The core of this concern rests on two separate but often intertwined ideas. The first suggests the standard vaccine schedule for infants and toddlers might trigger developmental changes that lead to autism. The second, more recent concern focuses on Tylenol, a common over-the-counter medication used for pain and fever. So, what exactly is autism? In simple terms, autism, officially called Autism Spectrum Disorder, or ASD, is a developmental condition. It affects how a person communicates, interacts with others, and how they experience the world around them. Think of it as a different way of processing information. A person with autism might have a brain wired differently, creating unique strengths and challenges. Some individuals may find it difficult to understand social cues, like body language and tone of voice, which can make conversations feel confusing. They may have very specific, deep interests in certain topics, and some of them find comfort in routines and predictability. Autism is a spectrum disorder. Every person with autism is different, with unique abilities and needs. Some may be nonverbal and need significant support with daily living. Others may have advanced language skills. Others may excel in science or art, and some live completely independently. There is no single look or behavior that defines autism. Avoiding stereotypes and seeing each person as an individual is crucial. Autism can present differently as a person grows. In young children, early signs can include a delay in learning to talk, not making eye contact, not responding to their name. They might play with toys in repetitive ways, like lining toys up perfectly instead of pretending. As they get older, they might struggle to make friends. They may feel overwhelmed by loud noises, bright lights, or crowded places. Sensory sensitivities are a common part of the autistic experience. Understanding these traits is the first step to providing the right support and creating comfortable environments. Autism is not a disease to be cured. It's a fundamental part of identity. It's a neurological difference shaping perception and interaction with the world. Many people with autism lead full, happy, productive lives. The goal is not to change who they are, but to provide tools, accommodations, and support, so they can navigate a world often not designed for their needs. With acceptance and the right help, individuals on the spectrum can reach their full potential and contribute greatly to our communities. The strongest evidence for the cause of autism points toward genetics as a major factor. Studies of twins show autism runs in families. If one identical twin has autism, there is a very high probability the other will too. Scientists have identified hundreds of genes that may increase risk. Many of these genes are involved in early brain development. They affect how brain cells communicate. For most people, it's not one single gene but a complex combination. Beyond genetics, researchers are exploring environmental factors before and during birth. These are not everyday environmental toxins. They are influences on the baby's development in the womb. Advanced maternal age has been linked to a slightly higher risk. Advanced paternal age has also been linked. Maternal infections during pregnancy are being studied. Extreme prenatal stress is also a possible factor. Events around birth, like lack of oxygen, are being investigated. These factors don't cause autism on their own. They may slightly increase risk in those with genetic predisposition. Vaccines have been intensely studied over the past 2 decades. Dozens of high-quality, large-scale studies involving millions of children worldwide have been done. The results are overwhelmingly clear. There is no link between vaccines and autism. The original 1998 MMR study suggesting a link was fraudulent and was retracted. Recent observational studies reported an association between frequent Tylenol or acetaminophen use during pregnancy and a slightly higher chance of a child having autism. Some studies also noted a small association with ADHD, but association does not prove causation. It may be the underlying reason for taking Tylenol, like severe infection, fever, or chronic inflammation, that influences fetal brain development. The science here is still new and uncertain. Medical experts advise pregnant women to be cautious. Use medication only when necessary, at the lowest effective dose, and after discussing with their doctor. While the exact causes of autism are still being uncovered, we can find hope and take practical action in what we do know. We know that loving, supportive environments help children thrive. Early diagnosis tailored therapies can make a world of difference in helping a child build skills and confidence. Good science is a slow and careful process that builds on many studies over time, not on one surprising headline or a viral social media post. If you are an expecting parent or have a young child and feel worried, talk to your doctor or a qualified healthcare provider. A good doctor will listen respectfully and provide honest, evidence-based answers so you can make informed decisions. Know where to find reliable information on your own. Look to established public health organizations and reputable medical institutions. Thank you for watching. Let us know your thoughts in the comments. Please like and subscribe to our channel for more informative videos.